Today we're going to be discussing Retin-A, one of the most important medical therapies of the 20th century. The first prescription-strength retinoid designed to treat acne. However, in a very short amount of time, it was noted that Retin-A offered multiple medical benefits. For instance, reducing hyperpigmentation while promoting skin healing, reducing sun damage, removing solar lentigines, as well as premalignant lesions. It also could soften mild acne scars, and later found to be a potent skin rejuvenator, reducing fine lines and wrinkles. Therefore, Retin-A has expanded from a simple acne therapy to the cornerstone of all the skin rejuvenations and anti-aging programs. Today we're going to be discussing both the benefits of Retin-A and some of the side effects of Retin-A. We'll find out how we could apply it to get the best effect. And finally, I'm going to answer the most common questions that I get from my patients once they start their Retin-A therapy. Hi, I'm Dr. Messina. And if you like this type of video with anti-aging, skincare, and laser therapies, click subscribe, hit the bell to be alerted to my future videos. Let's start with acne. Retin-A treats most of the problems that are associated with the development of acne, in particular, abnormal skin keratinization. And Retin-A causes an increase in skin cell production. That increase helps slough off the outer layers of dead keratinized skin, allowing the pores to reopen, therefore unclogging the acne lesions. If you're treating acne, it's important to adhere to the program and apply your Retin-A every night. Some people get an irritation due to the high level of cell turnover, and that irritation is self-limited, usually resolves by the first 2 to 3 weeks. Retin-A has several physiological effects that help rejuvenate the skin. And aside from increased cellular turnover, we also have increase in collagen production, elastin production, and beta fibrin. That all leads to an improvement of overall skin texture and skin quality in general. And you'll notice in about 2 weeks, your facial skin is going to feel softer and smoother. So let's get to the common questions. The biggest question is, when am I going to see my results? And of course, it makes perfect sense. Everybody wants to look better. Everybody who has acne wants to see it resolve quickly. So let's get into how that's going to work. It's really going to depend on what situation you're in and what physiological change is required. For instance, if you're treating simple acne, once we get to the resolution of the keratinization problems and we start airing out those lesions, you're going to notice an improvement in the first 3 weeks. However, 2 to 3 months in general is going to be the amount of time you're going to need to see a more profound change in your acne. Unfortunately, not every lesion is going to be treated by Retin-A, and you might have to add an oral antibiotic or a topical antibiotic these days, maybe even a laser therapy. If resolution of hyperpigmentation was your goal, then we're just going to simply have to wait for that increased cellular turnover. So in general, about a month. If you are doing it for fine line and wrinkle reduction, that's going to take a little bit more time. Then it's going to require not only the cellular turnover, but the collagen formation, as well as the elastin and fibrin formation. And those things take time. You could stimulate collagen production, but it takes a few months to be visible at the skin surface. So when you're dealing with fine lines and wrinkles, it's going to take 3 to 6 months to really see the benefit. Now, unfortunately, if you have deep wrinkles and folds, you have to understand this is a simple topical solution. It's not a facial plastic surgery. So you're only going to get limited results, and it could take up to a year if you have deeper folds and wrinkles. Question number 2, why do I have to apply it at night? Why can't I just apply it when I wake up? The reason is simple. Retin-A is destroyed by UVA and UVB rays from the sun. That means if you put it on and go into direct sunlight, you're going to neutralize and break down your Retin-A. And it's also important when you're wearing Retin-A to be careful of that. Wear a hat, sunglasses. Try to protect your facial skin from a lot of UVA and UVB exposure. Number 3, How do I deal with the irritation? Well, if you're using it for acne, you're probably on a higher strength and you're going to be using it nightly. You'll notice that irritation within that first week or two. If you hold the course, it's going to get better within 3 weeks. Now, some people develop something called the purge, and that's a profound proliferation of acne lesions, usually where you already have your acne lesions. Purging will also resolve spontaneously, but it'll take about 6 weeks. If you can't tolerate the nightly routine, you can decrease to every other night and slowly work up to nightly. And you could add moisturizers as well. If you are purging though, it's important to be gentle with your skin. Gentle washes, gentle cleansers, gentle moisturizers. Number 4, can I use Retin-A for the rest of my life? There are no studies that show Retin-A is harmful long term. However, there are situations where you're going to want to stop taking the Retin-A. First, pregnancy. Second, breastfeeding. And third, if you're having chemical peels or laser procedures, it's best to stop the Retin-A 2 to 3 weeks before those procedures because it's going to make your skin more sensitive. And number 5, what if I stop taking it? Well, if you stop taking it, you're going to start to slowly return to your normal levels. In other words, the collagen is going to decrease to what the collagen should be for someone of your age group, but it's not going to happen overnight. So slowly, you'll lose some or most of the benefits that you've had from doing it over the years. The good news is, after a period of time, there are Retin-A reserves deeper in the skin. So stopping it, technically, is not going to shut it off completely. You're going to go through your reserves, and it's going to take several months before you start to notice any type of deterioration. So now you can understand why Retin-A is one of the most important developments of the 20th century. And here's another video that I think you might like.